cost of healthcare down.
What steps and systems has VBS put in place to bring about solutions to the cost of healthcare and reducing the premiums?
Well, I'm going to answer your question here, but I'm going to also be a little careful because we don't want to give away our ideas. But we do want to educate you on there are cost containment systems out there that people can take advantage of. And what we've done is we've tapped into a variety of different systems that does basic things. Control the cost by getting better discounts than what the market was giving us before. And that's the number one issue. We have to get the cost of healthcare down. And that's not going to be done just by any old way. You're going to have to be tied into the different systems out there. And we have a lot of systems, but just to give you an example, we're going to be focused on using medical tourism. We're going to be focused on using domestic tourism. We're going to be focused on using what we call Medicare Plus. These three components alone are guaranteed to reduce the healthcare cost by 50% in terms of managed care. Therefore, we are now able to impact the premium that are also reduced by 50% or more. So we do have certain cost containment, disease control management program, and we have a variety of other systems that our administrators, when evaluating every individual case of an employer, we have different systems that the traditional carriers are using that you can also use from a self-funded perspective. But the most important thing is this. We have the data to tell you where cost is being spent. And once you have the data and you understand where cost has been spent, you can make adjustments. You can make tweaks like you do in every other aspect of your business. Kind of look at it this way. If you ran a business and you didn't have the data to tell you where your numbers were coming from or where you were spending money, you would go bankrupt because you don't know where to start saving. You don't know where to start cost cutting. Well, that's the same thing with this whole healthcare reform. Self-funding allows you to control and manage and know how to control your overall cost. The traditional healthcare system is not going to give you that information. They do it for themselves. They know how to control costs. They know how to manage care, but that's to their benefit and their profitability. That is not to your benefit as a consumer or a business owner who is paying for the cost of that healthcare. So I hope I answered your question, but I didn't want to try to give away too many of our secrets. But of course, if you become one of our clients, we will share all that information with you.